the impact of COVID on a whole bunch of things in healthcare was, nothing short of unbelievably dramatic. Uh, I think in terms of volumes, not only did the volumes shift to to COVID related care delivery, pushing out elective surgery, elective things. And again, you got to realize some hospitals ran with a lot of empty beds for a long time, just not being able to bring in people who probably should have had some things done for them, but couldn't because of the risks of them getting infected. Uh, I think the other thing that happened was a dramatic drop in ambulatory care visits, right? So about 50%, there are about 850,000 practicing physicians in the United States. About half of those are employed by hospitals, half are independent practitioners. The independent practitioners really had a tough time. They were not necessarily equipped to handle a situation where they couldn't see patients. And so that was another thing that didn't get as much press, but it really put at risk an important part of our healthcare infrastructure, these independent docs, who, by the way, who tend to be, with all due respect to the hospital-centric health systems that we have around the country, very important set of care providers of ours, a very important part of our infrastructure for care delivery. Those independent doctors tend to be a little more productive than the ones that are employed by hospitals. And
Hmm.
so a lot of care is delivered that way, and they couldn't deliver care the way they used to. That did help accelerate dramatically what many of us felt was going to eventually happen anyway, and that is the adoption of alternative care delivery models, technology to support telehealth, and alternative sites of care delivery.